In this episode of The Health Momentum, we explore the emerging world of alternative therapies in modern healthcare. Can energy healing, sound baths, and psychedelic-assisted therapy actually transform patient outcomes, and will insurance ever catch up? Find out now. Have you ever seen a patient leave a session feeling calmer, lighter, or genuinely better, only to discover that insurance will not cover it? It happens more often than you think. Patients are turning to energy healing, sound baths, crystal therapy, breath work, and psychedelic-assisted therapy, and they are reporting real improvements in stress, anxiety, chronic pain, and mood. Yet the healthcare system has not fully recognized these therapies, leaving many providers struggling to navigate billing, legal rules, and insurance hurdles. Statistics show that over 35% of patients with chronic conditions have tried at least one non-traditional therapy in the past year, and nearly 60% report measurable improvement in their symptoms. That tells us people are seeking alternatives, and many are benefiting. But despite the results, coverage is inconsistent. Most of these therapies do not have standardized billing codes, leaving providers either absorbing the costs themselves or asking patients to pay out of pocket. So, what are the real pitfalls? Assuming that insurance will automatically cover these therapies is a mistake. Attempting to bill psychedelic sessions using conventional codes without thorough documentation can lead to claim denial or even audits. Skipping rigorous outcome tracking or neglecting informed consent exposes providers to legal and ethical risks. Even when partial coverage exists, inconsistent reimbursement can create financial stress for clinics. The insights are clear. Providers who approach alternative therapies with structure, precision, and evidence are the ones who succeed. Documenting every session, tracking measurable outcomes, and building relationships with insurers can transform patient experiences into recognized, reimbursable care. The more data we have, the stronger the case for legitimizing these therapies within healthcare. Recent news demonstrates a slow but steady shift. Some insurers are piloting coverage for psychedelic-assisted therapy, and clinical trials have shown that up to 70% of patients with post-traumatic stress disorder experience significant improvements after guided MDMA sessions. Patients in these programs have maintained benefits for over a year. Clinics in some states, such as Oregon, are experimenting with insurance reimbursement for psilocybin therapy. It's clear that change is coming, and providers who prepare now will be ahead of the curve. Legal implications are significant. Psychedelic substances remain highly regulated, and providers must navigate state and federal laws carefully. Informed consent is not optional. Patients need to understand the potential risks, benefits, and alternatives of therapy. Missteps can lead to serious professional consequences. Alternative therapies that are not controlled substances also carry ethical responsibilities. Misrepresenting outcomes or overpromising results can erode trust and invite liability. Practical considerations matter just as much. Providers need systems to document session details, track patient outcomes, and measure effectiveness. Insurance discussions should begin before the first session, not after. Clinics must invest in staff training, patient education, and safety protocols to ensure therapies are delivered responsibly. Ethical considerations are central to this work. Alternative therapies often serve vulnerable populations, and transparency about outcomes, evidence, and coverage limitations is essential. Patient welfare should always come first. Therapy should never be offered solely as a revenue stream. Maintaining integrity builds trust and supports the long-term legitimacy of these emerging treatments. So here's my challenge to you. Have you tried alternative therapies in your practice? What has worked and what has failed? Share your thoughts in the comments below. Talk to your colleagues, share this podcast, and step into the conversation. Every documented session, every patient outcome, and every advocacy effort counts towards shaping a future where effective therapies are accessible to everyone. Thanks for tuning in to the Health Momentum. If you want more insights on healthcare innovation, alternative therapies, and navigating insurance and billing, subscribe, leave a comment, and share this episode with others. Let's bridge the gap between patient care and the system that supports it, one session, one therapy, and one conversation at a time.